All right, everyone. Good morning. My name is Michael Webb. I work with the Youth and School Communities team here with Pima County Health Department, and I'm excited to bring you today's school health update, along with some of our colleagues here in the EPI team, as well as Program Manager Matthew Schmidgall. Today is May 11th, and just want to congratulate all of you for coming to, for most of you, the end of your school years. And in the interest of respecting your time and getting this good information out to you, let's go ahead and proceed. All right, our agenda today. So as usual, we'll have some brief announcements. We'll revisit the Not Alone initiative, provide a COVID-19 update, some information on future schools calls, and give an opportunity for Q&A in the chat. So today's meeting is going to be very brief, and so feel free to ask questions along the way, and we'll get to those at the end. As usual, Narcan is available for schools. If you aren't aware of what naloxone or Narcan is, this is an opioid overdose reversal drug, so life-saving. And if you're interested in having these at your schools, please reach out to us at schoolsupport@pima.gov. We have plenty of supply. Our team here is the largest supplier of Narcan in the county. We also have presentations about fentanyl available for staff, youth, and families. And so if you're interested in having us come out to your school site to provide that, we're more than happy to arrange that. We also continue to have COVID test kits. And so these are available for pickup at our warehouse. And the enclosed link is available there in the second bullet point. You can also continue to schedule on-site COVID-19 vaccination clinics for your school and staff and the students and their families. And so all you have to do is contact PCHD's Vaccine Equity Program to organize a COVID-19 vaccination clinic at vaccineequityscheduling@pima.gov. Just a reminder, the Pima County website has been updated, and so we're very excited about the new look of our website, though with change comes some challenges. And so just wanted to point out if you have any important bookmarked links, they may not work, they may work, but in any case, if you have any trouble navigating to a resource that you're used to being able to access, please do email us and we would be more than happy to help you find what you're looking for. Um, I'll skip to the last bullet point since I already talked about this, but in terms of naloxone, if you're interested in wall mounts at your school for naloxone distribution, there may be some funds available. And so if your school site is interested, your nursing office is interested, please do, again, email us at schoolsupport@pima.gov. And then finally, if you are have any interested in having epinephrine or EpiPens, we may be able to help with that too. So whether you need EpiPens that may be expiring or need assistance with a standing order or acquiring medication, our team may be able to help you. So again, I'll direct you to that schoolsupport@pima.gov email. As we continue to wrap up the school year, this may be the most stressful time of the year for a lot of us, both staff and students. And so we want to continue to make you aware of the emotional wellness presentations that we do have for staff and students. If you are a fan of the digital age, we have a QR code here that would take you to the title listing page with all of the descriptions of the listed presentations. So topics include practicing mindfulness, managing stress, trauma-informed care, hacks, tools, and text, talk, act. So presentations generally last for about an hour in length. However, most of these presentations are modifiable to meet your needs. We can offer presentations just for staff, just for students, and potentially a mix in between. And so we'd be more than happy to work with you and our partnering agencies who provide these emotional wellness presentations. Again, if you scan this QR code here with your camera app on your phone, that will take you to that page where you can read and determine if you'd like to sign up for one of these for your school. Again, today we're bringing the Not Alone initiative into your awareness. And so Pima County Health Department acknowledges that youth mental health is a priority need in our community, especially as we come out of the COVID-19 pandemic and the state of emergency. And so we do know that 1 in 3 teens are struggling with mental health. And so we have come up with this initiative with a two-pronged approach. So first, we want to link young people in K through 12 settings, as well as staff who have tested positive for COVID-19 since May 1st of 2021, to up to 4 free mental health support sessions with a behavioral health technician. So the servicing agency for this initiative is Cope Community Services. We're very excited to be working with their Thrive Youth team. And when a young person or a staff member scans this QR code, it takes you to a page with a few brief statistics and call to actions. And there are 2 buttons at the bottom of that page, one that says help myself and one that says help others. To receive the mental health support, the brief intervention sessions with COPE, you would click Help Myself. That'll take you to a page with a brief FAQ section so that young people are as informed as they can be, and so that they can feel empowered to access the resource with as much knowledge as we have about what the resource entails. So when they fill out this referral form, they receive a call. It is during that call that parents and legal guardians are spoken to for verbal consent. And from there, some brief demographics are collected, and then we talk about scheduling either in person or virtually. So there is a virtual option to this. And just a quick note about these is if a young person speaks a language other than English, we have hired interpretive services. So if there's a language that a young person speaks and that's their dominant language, we are able to make this an accessible resource. So we're very proud about that. Additionally, if a family member or young person needs American Sign Language interpretation, this is also a video option available through this resource. The other prong here is you can see, so we are partnering with the Born This Way Foundation, who offers a peer training program all online. It's self-paced and offered in 3 languages, English, Spanish, and French. It takes approximately 2 hours, but if you're Gen Z, it probably takes you less. If you're someone my age, it may take you the full 2 hours. But in any case, this is intended to be a peer-to-peer training. And at the end of the training, a young person gets their Be There certificate. And so we know that young people are leading the way and supporting their friends, even if they're not using the words mental health, that they are a huge component of the mental wellness and well-being of our youth communities. And so we want to make sure that they have the skills to continue providing that support and even increase the quality of that support. So there are a number of ways to engage with the Not Alone initiative. If you are a teacher, administrator, nurse, counselor, social worker at your schools and you'd like to have Not Alone materials, we do have an entire toolkit available for you. And so the second link here where it says please click here, that is what we call the Not Alone Resource Hub. And so any of you today could go there and see every single English and Spanish resource that has been created for the marketing of this initiative. And so you can print materials in-house. We also have a limited supply of materials here at the Abrams Public Health Center that we could deliver out to your site. If you're in a TUSD middle or high school, you should see materials coming out to all 36 middle schools and high schools this week. We've been working with Dr. Joseph Gaw and appreciate his leadership in helping us get into your schools. But we are in all of the school districts here in town, and through Pima County, we're hoping to spread even further. If you have questions about this initiative, please do email us at notalone@pima.gov. Looks like I clicked a link, y'all. Sorry about that. There we go. All right, so Now we're going to move into our COVID-19 update. And so I want to invite a member of our EPI team. Anissa, I think I see you on the call.
Hi, good morning. Yes,
Good morning.
so I'm not sure if Matt Christenberry's here today, but
Yeah.
so it looks like we're still at low transmission. I don't have any other updates as far as COVID goes, but if you have questions that you'd like for EPI to address, please let the schools team know and we can get back to you on that.
Excellent, thank you. And I'll just point out a few things on the slide that the current community level is low as of May 4th, so this is updated every Thursday morning. And Anissa, feel free to correct me if I don't get any of this right, but we are currently experiencing a substantial rate of transmission. The current case rate is 66.84 per 100,000, so that's down 22%, which is awesome. We are seeing a test positivity rate of 3.86, and that is down about just under 1%. So very excited about that. In terms of vaccinations, I mentioned that, uh, we do have the ability to come directly to your school to provide COVID-19 vaccinations and boosters. And so just a key piece here is that only 24.4% of ages 5 plus have received an updated bivalent booster. And so school community partners can play a huge role in helping bring us to these populations to make sure that they have access to vaccines if they would like to have them. And then again, this link here is where you can always review the COVID-19 progress report and local recommendations.
Hi, Michael. If I could just add something, this is Eliana.
Yeah, please.
Just on the, I'm also an epidemiologist at Pima County Health Department. On the bivalent booster news, they were updated late April, very early May, mostly to increment the number of boosters that could be recommended for high-risk populations and people that are over 65. So if there's any staff members in that population within your schools, they might be eligible for another dose of booster. Once again, recommendation from the CDC, and we can always make that available to you. As Michael mentioned earlier in the presentation, vaccination will continue to be free through Pima County Health Department, so we can help assist with that. And I can take over the slides also if you want to scroll to the next one.
Oh yeah, that would be awesome.
No
I'll add
problem.
one more thing. I actually come from the vaccine equity team prior to my movement to the youth and schools team. And so I know that team is very eager to get out into the community, and they do a lot of outreach. And I know that planning out for the academic year is one of those things that happens months in advance. And so even if you're thinking, this might not be possible with the remainder of time in the school year, we would absolutely love to be able to be part of your registration and enrollment period. So if you have days at your school that a lot of parents and families are going to be coming in to complete their enrollment packets for new students to the school or returning students, we would love to be able to set up a table or two and just kind of exist in the corner and catch folks as they come in and go. And so that could be a really good way to go ahead and get that on our calendars. Again, vaccine equity scheduling at pima.gov is the email that you would contact us through to get that scheduled. And then Eliana, I'll turn it over to you.
Thank you. And I think we can go on to the next slide. And this is the community level. I'm sorry, no, just say that one. Community level for us, as it was mentioned, this has not changed in the last couple of weeks, as I am aware. And it can for us, for Pima County, you can see at the very bottom of Arizona there continues to be low. A little bit of a change, less than a percent point, but it has been low for quite a bit. And then next one, please. And this is just for your awareness how the community level metric is defined as per the CDC. Just as a quick reminder, as of this week and moving on to following weeks, this is one of the metrics that will cease to be updated as per the end of the public health emergency. But for the information that we do have most updated, we are at a case rate of 66.84 cases per 100,000 population. and this matches with our green metric. Next, please. And then for COVID-19 community transmission, which is another one of the data points that the CDC tracks, as per a couple of slides ago, we continue to be in substantial transmission, a little bit of a decrease in change there, but continues to be in the orange. Once again, same as the metric explained on the slide before, this is also one of the ones that will cease to be updated with a public health emergency ending later today. Next, please. As always, if there is any question, like Anissa mentioned, we continue to be available should there be any reportable diseases that schools see in their midst, including outbreak reports. To please contact epidemiology through the email that is in your screen, and also the phone number is available. We do have staff that answers the phone. You may get a voicemail if there is high call volumes, but they should be able to manage transferring the call as needed to somebody in our department. We also have a phone number. And I think that is the last slide for Epi.
Yeah, thank you so much. I appreciate you.
No problem.
And so, as I mentioned, we do have a short call today, so we'll move into our closing remarks here. So just a reminder, so the last schools call for the 2022-23 academic year will occur I don't know why that says May 11th, but it will occur in 2 weeks from today, May 25th. And so that will be our last school call before we recess for the summer. So a couple of things you should expect: new meeting invites in the late summer. We want to make sure that you know that we don't go on recess. And so our team remains available to answer any questions and offer support throughout the summer. Again, that's school support at pima.gov email. You probably have it ingrained in your memory because I say it so much, but please do reach out to us, though. That is designed specifically to make sure that our school partners are supported. So we will be examining the best way to continue calls moving forward, looking to streamline communication and create opportunities for more engagement. And so be on the lookout for a brief survey as key stakeholders attending this meeting every 2 weeks. We want to make sure that this is a useful time for you and that the information that's being communicated is meaningful and you're able to effectively implement that. And then to talk about the public health emergency ending today, I want to invite on Matt Schmidgall. Matt, are you on the call?
Hi, everyone. Yeah, thank you, Michael.
Awesome.
Just really briefly, I know there's been a lot of questions and some people feeling a little bit anxious as today actually marks the end of our public health emergency. Our teams here have met internally with our leadership. We reviewed all of the current guidance that's been currently communicated to our schools here in Pima County. And really what you all need to know is guidance at this time, at least for the remaining of the school year, is not changing. So we will resend after this school's call our guidance that we had issued last fall for the school year. That still remains intact. Just want to remind everybody that is guidance. None of that is mandated. We do not have a sanitary order in place. So this is guidance recommendations from the health department, but ultimately it's your school policy that will probably determine how you operate. So I saw a question in the chat from Laura about if employees are still required to isolate for 5 days. That is still the guidance. If someone tests positive, they should be isolating for 5 days. And then depending on their symptoms, if those are resolved, they can come back and wear a mask through day 10. But again, that's the recommendation. Ultimately, your school policy will determine how that plays out. After the school year, we're going to be holding more kind of strategic planning sessions this summer to determine the best way to offer guidance out to schools. Most likely, what that's going to look like is less information specific to COVID and more general guidance on how to mitigate respiratory disease. So that will include flu, RSV, COVID. There might be some specific guidance to each of these specific disease, but we're probably going to be moving towards more generalized guidance for everybody. We do, like Michael mentioned, planned and intend to continue the calls. They might look a little bit different. We are looking to streamline our communication, so that could mean more frequent, like weekly email correspondence going out, but our calls together, perhaps that changes to a quarterly webinar presentation where we can really get into more of the work we're doing as a health department. And then also looking for opportunities to make these a little bit more engaging. We know these are a broadcast of us talking heads at you, and there's not a whole lot of back and forth conversation. So we are looking for opportunities to create. And in the meantime, you're all more than welcome to reach out to us. If we haven't spoken to your district yet, specifically about a plan moving forward, as our emergency order ends, we would welcome that conversation. Reach out to me. We're happy to meet with your district leadership or your school leadership and kind of walk through the best plan for your school. I know that two Thursdays from now is going to be a very busy time for most people. And so if you're not able to make that call, just be aware that new calendar invites will be coming. We also have some shifting happening with our team. I want to give out a huge shout out to Michael Webb, who is on loan to my team and has been taking over these calls and doing an amazing job sharing this information with you all. As our grant ends, Michael's role will also be transitioning. The good news is we hope to bring on a new employee that I can introduce you all to on Thursday, 2 Thursdays from now. So yes, appreciate the rounds of applause for Michael. Well deserved. Thank you, Michael.
Thank you, Matt. So I'll take it from here and we'll close out the meeting. And you know, if you have any further questions that don't come up right now in this meeting, please do feel free to reach out to us. We get really excited when you all contact us and we're able to help. So help us help you. All right, so just a reminder, some of the things that we've talked about here today will be included here for your accessibility when we send out the follow-up email to this meeting. And I've gone ahead and continued to include the Youth HIV/AIDS health promotion toolkit that we discussed at 2 weeks ago when we had members from our clinical team come and present. As April 10th every year is Youth HIV/AIDS Awareness Day. And so wanted to center some sexual health resources for you to bring to your students. All right, again, some of the contact information. I've said school support at pima.gov a million times, but there is also this phone number here that you can reach us at. And so this is staffed, again, 520-724-7018. And with that, that is all that we have for you today. So I'm not seeing any questions in the chat, but I always like to give about 15, 20 seconds, just in case you have something that's percolating, something that you're thinking about and you're typing in. Want to make sure you have that opportunity. All right. Well, I want to just say I'm deeply inspired by the work that all of you are doing. Many of you I've been able to meet through the Not Alone initiative, coming out and visiting your schools. I just want to, on behalf of Pima County Health Department and the schools team here, just thank you for your dedication to the health and well-being of your students. I know that all of your are real sources of strength for these young people. And as you come to the close of your school year, I also hope that you're able to take time to take care of yourselves. And with that, we'll see you in 2 weeks. Thank you so much.